I'm the sponsor for Nest, and I lead the Insights Engineering product family at Roche. And so this talk is going to be kind of from the perspective of a sponsor. How are we viewing that return on investment from putting our pan study code out there as open source code? So there's been a fundamental shift over the last few years in how we handle the pan study code we use to report clinical trials. This revolution has been centered on the language we use to create datasets and the resulting plots and tables required to show the efficacy and safety of our drugs. One important note is that even when we relied on proprietary languages, we still had a large code base internally that would generate the data and statistics and the plots and the tables. As we've transitioned to R, we've also seen a shift to making that large internal code base an open source code base. And through initiatives like the Pharmaverse, we also see companies actively collaborating on this shared code base, rather than the historical pattern where within each company, within our firewall, we had our own code base and only snippets of it got shared out at conferences. This deduplication is in theory fantastic for patients in terms of decreasing the resources needed to maintain the code that reports clinical trials, and it allows us to amplify our efforts through sharing and collaboration on this code between companies. The one question I kind of want to start to look at today is, can we see any of these benefits? So why is this a new topic? SAS macros can and have been open sourced. But I think one of the fundamental things is the culture differs between SAS and R developers. And I think if you browse the SAS forum, like the screenshot on the right, you see a lot of examples where I think people are either afraid to open source themselves, don't want to put themselves at risk, but also they're afraid to use code from other people. And so there's kind of a fundamental difference here where R's always had this culture of people wrapping up their code into something that can be reused. And then there's that slightly strange scenario of what does it mean to open source code if the language itself is not open sourced? And so I think that's kind of one of the other barriers to an open source culture existing before, because you still had to pay a lot of money if you wanted to actually run the code. So there's two kind of main initiatives around collaboration and code for late stage. So one of them is OpenStatsWare, which is essentially a group of academics and industry working to ensure statistical tools exist for clinical trial design and generating the statistics used in clinical reporting. And then there is the Pharmaverse, aiming to nurture and promote collaboration on tools to generate SCTM and ADAM, right through to submission-ready outputs, and all those kind of supporting packages that make that pipeline possible. A phrase we used to use in the early days of open sourcing our clinical trial code base was a rising tide lifts all boats. We put it out there and people might consume it and get benefit, but we're not kind of doing this on the expectation of us benefiting. But now, several years into building these collaborative code bases, we can start to kind of tackle that question, are we actually getting back more than we put in? So there are two ways we can tackle this question. The first being objective. The actual comments pushed into the relevant Git repositories, represent actual changes to the code. And then the second is more subjective. The feedback from issues or other interactions, for instance, helping to improve the code base, but often this is something where you can't quite easily capture it just by pulling data out of GitHub. Starting with the objective measures, this is relatively easy for us to pull. We curate a list of GitHub handles used by people from our company, Roche, including periods of employment. And that periods of employment is important because one of the great things about this common code base is that we've had multiple examples now where someone may leave or come into Roche and have worked on the exact same R packages before or after at a different company. So then we can use this list to try and understand which of the contributions are coming from Roche people and which are coming from externals. So this plot shows the percent of comments that are from Roche across all the packages important to Roche in the Pharmaverse and OpenStatsWare. We see in many MUMPs, the majority of the code we use across studies is actually from external people in statistical settings. And for clinical reporting, the Pharmaverse, around a quarter of the comments are coming from people outside Roche. For the Pharmaverse especially, if we were to show this plot in our old model of keeping the code fully internal, so for us, those were our legacy code bases called DTS and Stream, we would see 100% of the code being written by people in Roche. But thanks to our shift to Oak, Admiral, and Nest, we are seeing contributions coming back to the code from people outside our company. And I fully acknowledge here a comment could come in any forms. It could be fixing a spelling mistake right through to releasing a whole suite of new functions. But this at least gives us an indicator that yes, through open sourcing, we are getting contributions back to our pan study code base. Another way to look at this data is to take the lines of code written. So this is a snapshot from the 28th of October this year, with a few select packages where I've taken the blame for each line of code to figure out if the code was last edited by someone from Roche or someone external. Again, this is a nuanced measure, as it is a last edit to a line of code, even if that edit was something trivial. But it again helps us to show that across key packages, we are seeing contributions back to our code base from external parties to Roche. While this and the last slide do not quantify, for instance, how much FTE we saved through their contributions, or even if those features were desperately needed by us in Roche, I believe they give some strong quantitative evidence that open sourcing was not just throwing our code out there for the sake of it, but has shown that we have collaborations happening in developing this code base, and in some cases, for instance on this table Metacore, we are able to leverage and improve others' packages and use those packages to fill in gaps within our own code base. Now, repeating that kind of concept of lines of code, but now kind of summarizing over all 25 R packages that are relevant, we again see that in the snapshot of code present at the moment, about a quarter of the lines of code were last edited by someone from outside our company, just kind of reinforcing at the kind of global level. This is a pretty consistent amount of collaboration, and we're getting on the code that's important to us to deliver our clinical trials. So if we start to get into the subjective benefit of open sourcing the code base, it's a much more difficult thing to quantify. But I think this plot from the Pharmaverse website helps to show the connections between people that are being built across companies through working on this common code base. So it's a network plot showing where different people collaborate on the same packages. And I think this is really important because it simplifies the transfer of knowledge and good ideas and feedback across companies when they're actively collaborating on the same package ecosystem. And as I mentioned before, talent transfer is much easier now. So rather than each company having its own flavor of how they'll internally set up and run their code bases, here we have kind of this shared code base, and so people are much more easily able to pick up and work as they move from company to company. So far we've established we do get back contributions, but it's quite difficult to assess what the value of those contributions are. For instance, we can't say, we had 44 pull requests and that saved us X FTE on what we would have had to commit personally from our company. But I think this is an example of an interaction where someone from outside of Roche was making a pull request, someone from Roche as well as someone from another company were kind of commenting and discussing it. And it's, I think, a really good example of, and there are many of these examples when you browse the pull requests, of really meaningful contributions being made from people outside the company into packages which are critical to us. So is there actually a cost? One concern I always have is that someone will use your package but not contribute to it and then ask you questions. So that introduces a support cost. And while this can be true to a certain degree, looking at the quantity of interactions and discussions happening on the repositories on GitHub, we see a pattern that mirrors what was seen in terms of who was actively contributing to code. And I don't hear kind of cries for help because of people external asking random questions. What we often see is these kind of questions around helping support a person for a particular issue. That's not about fixing the code base, but more the person's own problems. For instance, their setup. Those tend to be fixed in internal forums. So for instance, we have a discourse-like server within Roche called Overflow, and almost all of those sorts of kind of questions go there rather than back to the original repository, using up time for the developers doing first-line support. So in conclusion, I think we have shifted from a pan study code being almost completely internal to it being an open calibration through initiatives like the Pharmaverse and OpenStatsWare. And this collaboration has aspects, so not the full picture, but it has aspects that can be very easily measured through accessible proxies like commits and lines of code and interaction on issues and stuff like that. So it's certainly not the full picture, but we are kind of able to kind of easily track month to month these simple proxies of engagement and contributions into the code. And there are many examples of significant improvements coming into the code base from external people. So I think we can say, while we don't know the exact return on investment, there has been a net positive return on investment from taking the steps to open source our code and engage in initiatives like the Pharmaverse. So there's a link here as well, which has much more details on the methods used as well as the raw code that was used in this slide and in the manuscript. Thank you.